Now, on this other half of the program, we shift our focus to the advocacy campaign on the provision of better health system across the sub-region. Now, this is being run by West Africa think tank WATI. In the course of the pandemic, the civil society organization came up with several recommendations and action points to restore the sub-region's health system after COVID-19. We spoke with the advocacy officer, Dan Vieira da Costa. Thank you very much, Dan, for joining us on this episode of Wellbodi.
Thank you, Imo, for having me.
Let me start by asking you to tell us about the work WATI has been doing on health systems for a year now.
Thank you so much, Imo, again. I just wanted to present very briefly, very quickly, WATI in 2 or 3 sentences. So I wanted to say WATI is a civil society organization that focuses on West Africa. And in WATI, we believe that the critical issues faced by West African citizens can be addressed if they are provided access to locally produced, inclusive, participatory, and good quality research and analysis about social, cultural, political, and economic issues and challenges in the region. We believe that if the citizens can set the agenda and contribute to discussions and debates on key issues for institutional and policy change, then they will have critical ingredients to be able to influence positively to social, economic changes in their societies. Based on that, in early 2020, before the outbreak of the pandemic, WATI released a report that we call Mataki on how to improve the functioning of health systems at the benefit of the populations in West Africa. So the report the Mataki was based on a research work and experts interview. The report revealed the actual situation. It was kind of a situation analysis of the health systems in West Africa, their functioning, with figures and testimonies from health professionals and experts. But most important, the report made a series of 5 recommendations with respective action points on how to improve the functioning of the health systems. So this is basically this was a year ago. Then we started after the report was published. We started the dissemination and advocacy work around those 5 recommendations on social media, traditional media, etc. So this is what we have been doing from a year now. We are trying to make those recommendations available to the citizens, and also trying to make those recommendations considered simply by our decision makers when they discuss key policies on key health policies at national level or at regional level.
Tell us more about the number 5 recommendations.
The 5 recommendations are basically the outcome of the research work and the outcome of the discussions organized by WATI among the citizens, but also with health experts that were first of all telling us that, okay, this is the situation in my country on the funding of the health systems, on the functioning of health structure. This is what we're experiencing in our countries, and this is what we are suggesting to improve the situation. So WATI made that work of compilation work of all the recommendations and extracted 5 main recommendations. The first one is related to prevention. It's about putting in place a preventive policy to combat diseases at the heart of the health systems, namely by investing more in prevention and primary health care. For example, investing more also on prevention of illnesses, domestic accidents. Talking about prevention at schools to parents, but these are some, and I forgot to say that each recommendation has a series of sub-recommendations or action points that indicate how to get or how to achieve the recommendation. And then we have the second one that is related to human resources, that is formulated like this: ensuring the training of sufficient human resources for health, including mental health, their equitable distribution throughout the national territories and their effective supervision. This one is about the training of the health professionals, their equal distribution on the national territories, because we know that in Africa, I can take the example of Senegal, or where you have like 90% of the specialists in Dakar and 10 other person divided in the other regions. So it's about equally distribute the health professionals, and also have an adequate training. And we have also 11 sub-recommendations or sub-action points leading to the achievement of those recommendation. And then the third one is about the funding of the health systems. And we're recommending to improve the funding of health systems to promote access to care and to medicines. And I can give, for example, one of the recommendation, or one of the action point here is to consider the investment in public, universal and free health systems as the first priority of governments. And here we are talking about the objective of the 15% of the of the budget of the countries to be specifically devoted to health sectors. It was a target set by the government in Abuja in 21, in April 21. So it's just a matter now of truly working to get that implemented. And then the fourth recommendation is about the health structures. So to improve the functioning of the health structures, because we all experience once going on a hospital and seeing the hospital not very clean, for example. The prices, one day you go and you pay this price, and the other day you go and you pay another price. It's just a matter of having the day-to-day functioning of the health structures improved. So this is important also. We understand that it's important. And the fifth and the last recommendation is about strengthening national health systems through the development of research, but also the pooling of resources at regional level and the institutionalization of public debate on national policies.
All right. Well, quite a handful there. Now let's look at how you are disseminating these recommendations.
Yes, actually, we already started that dissemination process in like a year now, since October, a bit less than a year. I must confess, since October last year, October 2020, and we have different components here also on this. The first one is actually, as you mentioned, the dissemination. We are doing this through a social media campaign that we started in 2021 on our social media platforms, on Facebook, on WATI's Facebook page, WATI's Facebook, WATI's Twitter account, on LinkedIn also. So the main idea is to, because obviously we cannot just share the report and say that we disseminate. We need to turn those recommendations, we need to turn them more social network friendly. And we need to have in mind that it's not only experts that will be reading those recommendations. The objective here, the targets here are the citizens, like regular citizens, are not necessarily health experts. I want to call them to engage them to this advocacy work we are doing, WATI is doing. Follow our social media accounts, so the Facebook page WATI, West Africa Think Tank, on Facebook, on Twitter, on Instagram, on LinkedIn. Go check also our website, www.wati.org, on the section debates and most specifically the debates on the health systems, where you will find that Mataki, the full version and the short version. Share the public wing, share the recommendation. It's for us, it's for African, it's for West African citizens. We are striving to improve the functioning of our health systems and consequently the health of the population, of the West African population.
Indeed, Dan, thank you so much for talking to us.
Thank you very much, Imo, for having me in the program.
That was WATI's Advocacy Officer Dan Vieira da Costa.